goal of Medicare Made Clear for business decision makers is to provide a foundational understanding of the Medicare program relevant to executive decision makers. You will learn about the history of the Medicare program, Medicare basics, group Medicare, the dual enrollment problem, and regulatory issues that impact employer health plans. We will introduce the Medicare Planning Fringe Benefit, explaining how and why it works. A plan member and plan sponsor scenario will illustrate the benefit of transitioning to Medicare and the cost-saving impacts on plan members and plan sponsors. Your company will be invited to participate in a Medicare Planning Fringe Benefit pilot project. Pilot project goals and the implementation process will be explained. We will wrap up by responding to your questions. Business executives routinely evaluate the performance of their employee benefit plans. Very few executives are aware of the impact Medicare has on the cost of their employee benefits. Understanding the fundamentals of Medicare enables executive decision makers to recognize opportunities to significantly reduce employee benefit costs while simultaneously improving employee satisfaction. Assume a healthcare system has 5,000 employer health plan members. 10% of the health plan members are age 65 or older, representing 500 Medicare eligible plan members. The healthcare system is self-insured, paying plan member medical claims from their balance sheet. Single plan members pay $5,600 in premiums annually. The healthcare system's average annual cost of coverage for each Medicare eligible plan member is $25,000. Medicare eligible plan members cost the healthcare system a minimum of $12 million annually in medical claims. Transitioning 80% of the Medicare eligible plan members to Medicare can potentially save 400 Medicare eligible plan members more than $2 million in annual premiums and save the healthcare system more than $10 million annually in reduced benefit costs. Today, your organization will be presented the opportunity to achieve this magnitude of benefit cost savings in a manner compliant with federal law.
We wanted the world to know that we haven't forgotten who is the real daddy of Medicare.
The Social Security district offices were kept open into the evenings for people who were still at work.
I will submit legislation shortly to help free the elderly from the fear of catastrophic illness.
He's supposed to represent the people, not himself.
Once seniors' annual drug costs exceed $2,250, they fall into the so-called donut hole.
Now that the plan is in place, 39 million have signed up for it. Drug costs are less than anticipated.
We are done. Beginning next year, preventive care, including annual physicals, wellness exams, and tests like mammograms, will be free for seniors as well.
To provide context for the size of the Medicare program, during 2018, U.S. federal budget expenditures were $4.1 trillion. The Department of Defense and Medicare both consumed about 15% of the federal budget. 2018 Medicare expenditures were $605 billion.
Okay, so you're trying to understand Medicare, and it can be really confusing. Like, when do you have to start thinking about all this stuff? Well, if you're coming up on the magic 6-5, it's time. Or, if you're like a lot of us and retiring later, you're ready as soon as you don't have employer health insurance anymore. Maybe you already have a Medicare plan, but you're thinking about switching it up a little bit. No matter what's going on, you need to know some basics. So, let's get started. Medicare has 4 parts: A, B, C, and yep, you guessed it, D. Plus there's this 5th thing called supplemental. We'll get back to that. So, what do the letters really mean? Well, Part A is for when you go to the hospital.
Paging Dr. Bender.
And you get it just by signing up for Medicare. We have a whole nother video that explains signing up. For most, you get Part A automatically, and it costs you zero, nothing. Parts B, C, and D, on the other hand, are optional. If you want them, you buy them. Part B is for when you go to the doctor. Stuff like routine physicals, blood pressure checks, tests, things like that. Part C, well, let's say you want to add eye care or dental coverage or something else. That's where Part C comes in. It's also called Medicare Advantage, and it's pretty cool. Part C combines A and B, along with some of the other stuff you want. Then there's Part D. Part D is prescription drug coverage. Now, you can buy it on its own, or you can get it with Part C and wrap the whole thing up in one neat little package. You can also buy a supplemental policy if you want. They're called that because they cover some of the costs not included in A or B. Well, there you go. Those are the basics. Still want to know more? Go to Medicare.gov or check the other videos in this series at MedicareMadeClearer.com. Time for some math. When you add Medicare Part A plus Part B plus more, you get Part C. Part C is also called Medicare Advantage, and there's a good reason why. It's because Medicare Advantage plans help with hospital costs, doctor visits, and other medical services that you get with original Medicare. Plus, they can include prescription drug coverage, as well as coverage for vision, hearing, and you bet, even gym and health club memberships. All this comes in one plan with just one plan ID card. Medicare Advantage plans are run by private insurance companies. So how do they work? Well, for one thing, you have to be eligible for Medicare and paying your monthly Part B premium. For another, many Medicare Advantage plans come with an annual deductible to help keep your monthly premium down. You pay a copay or coinsurance for only the services you use and not for those you don't. Finally, to help keep your costs down, you may have to pick a doctor who's in the plan's network. Some plans offer more choices in doctors by letting you get services out of the network, but you may have to pay more. All plans are the same, and not all are available in every state or county, so you'll need to find out what plans are available in your area. For most, you can enroll in a Medicare Advantage plan when you hit the big 6-5, or once a year during the annual enrollment period. That's a good look at Medicare Advantage plans. Still want to know more about Medicare? Go to Medicare.gov or check the other videos in this series at MedicareMadeClear.com.
There are 3 Medicare enrollment triggers relevant to Medicare eligible employees: automatic enrollment, aging into Medicare, and loss of employer coverage. Automatic enrollment occurs for disabled Social Security beneficiaries on the 25th month after approval of the qualifying disability. Social Security beneficiaries claiming benefits prior to their full retirement age are automatically enrolled the month of their 65th birthday. This circumstance causes the dual enrollment problem. Social Security beneficiaries claiming benefits after age 65 can do so online with an SSA.gov account. The enrollment questionnaire provides the option to receive Social Security income benefits while deferring Medicare Part B. This eliminates the plan member's exposure to the dual enrollment problem. Aging into Medicare begins at age 64 and 9 months. You must enroll in Medicare Part B if you don't have group health insurance. Your deadline is the 3rd month after the month of your 65th birthday to avoid the late enrollment penalty. Loss of employer coverage upon retirement triggers a special enrollment period enabling enrollment in Medicare Part B. After age 65, Medicare eligibles can enroll in Medicare Part B at any time. Let's talk about employer group waiver plans, also known as group Medicare plans. Employer group waiver plans, EGWIPs, otherwise known as group Medicare plans, were created by the Medicare Modernization Act of 2003. They are a relatively new and largely unknown form of group health insurance coverage provided by the Medicare program. EGWIPs provide affordable retiree benefits through public, private employers, and unions. EGWIPs are contracted through Medicare Advantage organizations, third-party administrators, or directly with CMS. EGWIPs offer Medicare Advantage coverage. CMS can waive regulations for EGWIPs that inhibit plan design or enrollment. You can see from this chart that group Medicare plans are becoming more popular. This map illustrates the percentage of Medicare Advantage members enrolled in group Medicare plans by state. Dark orange states have the highest percentage. Dark blue states have the smallest percentage. Group Medicare plans provide a lower cost alternative to covering retirees on employer group health plans. Plan member risks are transferred from the employer to CMS. Group Medicare plans provide equivalent coverage with value-added benefits not provided by original Medicare. Most group Medicare plans are local, regional, or national PPOs with enhanced provider networks and prescription drug plan options. Group Medicare plans are subject to the Medicare Advantage star rating system. And group Medicare plan members have the same rights and protections as individual Medicare plan participants. How does Medicare impact health plan sponsors and Medicare eligible plan member benefit costs? Social Security gives workers the option to take benefits anytime between age 62 and 70, and it offers incentives to those who are willing to wait. Those who claim income benefits at age 62 have to accept 75% of what they receive at full retirement age. Social Security automatically enrolls early income benefit recipients in Medicare Part B at age 65. Most retirees either cannot afford to wait or don't think the trade-off is worth it. Yet despite the prospects of getting larger payments from Social Security, 62 is still the most popular age for people to claim their Social Security income benefit, according to the government's most recent data. A growing number of Americans are working after age 65 for a variety of reasons, including good health, the need for income, and to maximize future Social Security income benefits. A recent Pew Research study estimates that almost 20% of the U.S. workforce is represented by workers age 65 or older. These Medicare-eligible employees are typically enrolled in their employer group health plan. Most of these Medicare-eligible employees have access to suitable cost-saving Medicare plan options. The problem is they don't know how Medicare works and can't compare the cost of their group health insurance plan with their most suitable Medicare plan options. The 2020 Kaiser Family Foundation Employer Health Benefit Study found the average annual employer health plan contribution to be nearly $16,000 for single plan members. The average annual single plan member contribution to be almost $5,600. Most eligible plan members would be better served in a suitable Medicare plan. Most eligible plan members choose Medicare Advantage plans with a $0 monthly premium. After the eligible plan member enrolls in Medicare Part B and transitions to Medicare, the plan sponsor saves an average annual benefit cost of nearly $16,000 per eligible plan member. Eligible plan members save an average of more than $5,000 to over $10,000 in annual premiums and cost-sharing expenses. Everybody wins. Medicare eligibles cost more. There is a direct correlation between age and healthcare cost. Healthcare risk increases with age. The aging process increases exposure to chronic illnesses. These illnesses require medical treatment, which can be expensive. This chart from a Kaiser Family Foundation study shows the percentage of Medicare beneficiaries experiencing functional impairment, fair to poor health, and multiple chronic illnesses. Though the average annual employer health benefit contribution is around $16,000, Medicare eligibles' average annual employer contribution is 2 to 3 times the national average, depending on the claims experience of the employer group plan. Those automatically enrolled in Part B, while simultaneously enrolled in an employer health plan, are paying a 2022 annual Medicare Part B premium of $2,041 they don't need and can't use. An estimated 6 million Social Security recipients are affected by this problem at an estimated cost of more than $10 billion a year. These new Medicare beneficiaries typically don't know there's a high probability they could get better health insurance coverage at lower cost by transitioning to Medicare. Correcting this problem could reduce large employers' benefit costs more than $20 billion a year. This problem affects every large health insurance plan in the United States. What does this all mean? Most executive decision makers are unaware how Medicare adversely impacts employer health plan benefit costs. Improved longevity and economic factors are increasing the number of Americans working past the age of 65. Most of these workers are members of an employer health plan. Working Medicare eligibles don't know they can get better health insurance at lower costs enrolled in a Medicare plan. About 50% of these workers are paying a Medicare Part B premium that federal law prevents them from using. This dual enrollment problem has cost employer health plans and plan members over $1 trillion since 1980, when the Medicare Secondary Payer Act was enacted into law. Medicare problems and challenges. The 2019 CMS Medicare Marketing Guidelines prevent the side-by-side cost comparison of Medicare plan options. The inability to compare the known cost of Medicare plan options prevents Medicare beneficiaries from making fully informed plan selections and impairs price competition in the marketplace. The 2019 CMS Medicare Marketing Guidelines regulate marketing activities of licensed insurance agents. Medicare plan providers will not approve marketing materials that compare the known costs of approved Medicare plans with competing Medicare plan providers. It is not in their self-interest to do so. The Social Security Act requires Medicare beneficiaries claiming Social Security income benefits prior to or after full retirement age to be automatically enrolled in Medicare Part B on or after age 65. The unintended consequence of this regulation is an estimated 50% of working Medicare beneficiaries are paying an employer health plan premium and a Medicare Part B premium which they don't need and can't use, representing waste and abuse of over $9 billion annually. April 16th, 2018, Charles Wright, Principal Advisor at Health&Wealth Advisors, LLC, presented the following to the Secretary of Health and Human Services, the CMS Administrator, and the Health and Human Services Inspector General. Request for approval of an employer group waiver plan waiver that provides financial relief for Social Security recipients automatically enrolled in Medicare Part B while simultaneously enrolled in an employer-sponsored group health plan by allowing enrollment in a group Medicare plan, EGWP, without the requirement to be simultaneously enrolled in the employer-sponsored group health insurance plan. July 18, 2018, the following response was received from CMS. After careful consideration, we have determined that waiving the relevant MSP statutes and regulations would not be in the interest of the Medicare program. While we acknowledge that some working Medicare beneficiaries may have elected to enroll in Part B in error, we do not believe limiting the MSP rules as proposed is the appropriate remedy. CMS does not acknowledge the fact that automatic enrollment of Social Security recipients into Medicare Part B has the unintended consequence of creating waste and abuse for Americans simultaneously enrolled in an employer health plan. The estimated annual cost to Medicare beneficiaries and employer health plans is over $30 billion. This dual enrollment problem has cost the U.S. economy more than $1 trillion since 1980, when the Medicare Secondary Payer Statutes were enacted. The Medicare Planning Fringe Benefit was created to convert this specific Medicare program waste into significant employee benefit cost savings. Let's find out how this is accomplished. Have you ever heard the term MSP and wondered what it meant? MSP stands for the Medicare Secondary Payer Act, which was enacted by Congress in 1980. The statute prohibits Medicare from acting as the primary payer for any injury-related medical services or prescription drugs when there's another responsible party liable for the injury. According to the MSP statute, the following types of insurance plans are deemed primary to Medicare: workers' compensation, no-fault insurance, auto insurance, liability insurance, and self-insured health plans. The MSP Act requires that Medicare's interests be protected, and it prevents primary payers from shifting the burden to Medicare in the future, which would then reimburse Medicare at the time of settlement. Medicare secondary payer statute violations apply to self-insured large group health plans that discriminate against Medicare eligibles in ways such as failure to pay their primary benefits, offering coverage secondary to Medicare, terminating coverage when plan members become eligible for Medicare, limiting coverage for Medicare eligible plan members, charging Medicare eligibles higher premiums than other plan members, imposing longer waiting periods for Medicare eligibles, and offering financial incentives for Medicare eligibles not to enroll or to terminate employer health plan membership. Does the Medicare planning fringe benefit violate the Medicare secondary payer statutes? Let's find out how CMS answered this question. CMS determined the Medicare planning fringe benefit is entirely an educational material, meaning the Medicare planning fringe benefit requires no further compliance review by CMS. Designation of the Medicare planning fringe benefit as entirely an educational material eliminates CMS compliance risk exposure associated with large employer health plans because Medicare educational materials are not regulated and do not require compliance review by CMS. How and why did this occur? All marketing materials related to Medicare must complete a compliance review by CMS. On October 23, 2019, with the support of the National Association of Health Underwriters, the Medicare planning fringe benefit was submitted for compliance review by CMS. November 5, 2019, James Canavan, CMS Division of Surveillance, Compliance, and Marketing, under supervision by CMS Directors Christine Reinhart and Timothy Rowe, responded with the following. Thanks for your patience. CMS has reviewed your presentation and has determined that it is entirely an educational material. CMS does not require most educational materials that are designed to inform about Medicare Advantage, Part D, or other Medicare programs to be entered into the health plan management system or reviewed by a CMS marketing reviewer. However, the material must still meet the requirements in our Medicare communications and marketing guidelines. This conclusion by CMS mitigates large plan sponsors' CMS compliance risk associated with implementation of the Medicare planning fringe benefit. To further document the conclusions of the CMS compliance review, the following was requested. The prompt review of this matter by CMS is appreciated. For the benefit of Congresswoman Val Demings, National Association of Health Underwriters, and other stakeholders, please provide CMS's response on agency letterhead with the signature of the CMS manager overseeing the review process. CMS responded with the following. We appreciate your request, but it is outside the boundaries and requirements of our participation in this matter. CMS does not normally review materials submitted directly from third parties. However, we did so as a courtesy in this case. In the course of normal operations of this process, we do not provide the type of response you are requesting. The email I sent previously serves as CMS's official response on this matter. Large employers have the opportunity to reduce employee benefit costs significantly by offering the Medicare planning fringe benefit to Medicare eligible plan members. These cost savings are accomplished by educating Medicare eligible plan members about how the Medicare program works. Eligible plan members receive a customized Medicare plan comparison report. This report documents the known costs of the plan member's most suitable healthcare plan options. Exposure to this cost-saving information, along with consultations with a benefit advisor, compels most Medicare eligibles to enroll in a suitable Medicare plan. The Medicare Planning Fringe Benefit provides a compliant process for transitioning Medicare-eligible plan members to the most suitable Medicare plan option. Plan sponsors and plan members benefit from significant cost savings as a result of the employer offering the Medicare Planning Fringe Benefit. Mary Smith just turned 66 after working for the Acme healthcare system 20 years. Mary plans to work until she's 70. Her husband John is 67 and retired. John is a dependent on Mary's health insurance plan. John has Medicare Part B. Mary pays $400 a month for their Acme Group Health Plan. If John wasn't on her insurance plan, Mary would pay $200 a month for health insurance. Mary learned about the Medicare Planning Fringe Benefit that helped her understand their Medicare plan options. Mary and John completed the Medicare Fact Finder. After receiving their Medicare plan comparison report and completing the telephone consultation, Mary and John made some decisions. Mary has decided to enroll in Medicare Part B. Then she and John will enroll in $0 monthly premium Medicare Advantage PPO plans. Mary and John's transition from the Acme Group Health Plan to Medicare Advantage plans will save them over $7,000 a year in premiums and cost-sharing expenses. This is what Mary Smith's Medicare Plan Cost of Ownership Summary looks like. What compels the transition to Medicare? Medicare eligibles motivated to transition to Medicare after being exposed to the known cost of suitable Medicare plan options is explained by the economic law of substitution. The economic law of substitution was established by Austrian economist Hermann Serich Gaussen in the mid-1800s. The economic law of substitution generally states that consumers want to get the maximum satisfaction for what they spend for goods and services. Let's use Medicare Supplement Plan F to illustrate how the economic law of substitution would apply. Medigap Plan F is the most comprehensive and expensive Medigap plan option available. The benefits provided by Medigap Plan F are regulated by CMS. The price of Plan F policies is determined by each individual insurance carrier. Regulated benefits provided by Medigap Plan F policies are the same for all insurance carriers. The price of a Plan F policy is the primary variable differentiating Plan F policies among competing insurance carriers. The economic law of substitution predicts that when the benefits of a Plan F policy sold by different carriers are the same, the lowest price Plan F policies will be preferred by consumers. Suitable Medicare plans are those plans that satisfy the minimum level of benefits required by the Medicare beneficiary. If the known cost of Medigap Plan F is less than the known cost of the employer health plan, the plan member will generally prefer Medigap Plan F. The economic law of substitution is the foundation of price competition. The Medicare Planning Fringe Benefit introduces a new form of price competition to the large employer group benefit marketplace. Acme Healthcare System has 5,000 health plan members. 10% are age 65 or older, representing 500 Medicare eligible plan members. Acme Healthcare's management has decided to offer and promote the Medicare Planning Fringe Benefit to their 500 Medicare eligible employees. It's anticipated that 80% of their Medicare eligibles will transition to Medicare within 12 to 36 months. Assuming each eligible plan member costs the self-insured employer around $25,000 in annual benefit costs, after 400 Medicare eligibles complete their transition to Medicare, Acme Healthcare will achieve nearly $10 million in annual employee benefit cost savings that drops to the bottom line. The break-even point for recovering the $500,000 Medicare Planning Fringe benefit cost is the transition of 20 eligible plan members to Medicare, or 4% of their eligible plan members. Your company is invited to sponsor a Medicare Planning Fringe Benefit pilot project. This is an opportunity for a minimum of 25 to a maximum of 100 eligible plan members to experience the Medicare Planning Fringe Benefit. There is no charge for participation in a pilot project. If the pilot project sponsor proceeds with full implementation of the Medicare Planning Fringe Benefit, a service fee will be charged for each of the sponsor's eligible plan members. Pilot project sponsors are responsible for fees associated with production of the actuarial opinion required for each pilot project. This is the action plan after your decision to engage the opportunity. Complete the Medicare Planning Fringe Benefit inquiry form. Review the business proposal you'll receive. Complete the consultations necessary to making a pilot project sponsorship decision. Make a go pilot project decision. Sign the service agreement. Establish the pilot project performance goals. Select your project coordinator and benefit representative. Prepare the pilot project plan. Launch the project. Complete the project. Evaluate the pilot project outcomes, including the eligible plan member feedback forms and the actuarial opinion. Then make the full Medicare Planning Fringe Benefit implementation go, no-go decision.